Best marketing automation software for healthcare in 2026. If you run marketing for a hospital, health system, clinic network, or provider group, you're working under constraints that most marketing automation platforms weren't designed for. You're communicating with patients, members, providers, and care staff across multiple service lines and locations. And protected health information can't leak into campaign sends. Most marketing automation tools were built for other industries and adapted for healthcare later, which is why many marketing teams like yours end up running outreach in spreadsheets or fighting their compliance team for every approval. In this video, we'll break down what to look for in marketing automation software for healthcare, and we'll spotlight one of the strongest options in the category, the emfluence marketing platform, to show what a HIPAA-aware approach looks like. This episode is sponsored by emfluence, but as always, we're keeping things fair, data-backed, and buyer first. Let's dive in. What matters in marketing automation software for healthcare in 2026? Healthcare marketing is unlike any other category. The same platform has to support patient acquisition, service line growth, community education, and multi-location coordination, all without touching PHI in ways that create compliance exposure. Here's what consistently matters most when you're evaluating marketing automation software for healthcare specifically: HIPAA-aligned data practices. This starts with the basics: encrypted data transfer, protected infrastructure, and data handling designed to align with HIPAA privacy and security standards. If a vendor can't speak fluently about how PHI is treated, where it's stored, and how it's transferred, that's the end of the conversation, regardless of how good the campaign builder looks. Marketing safe personalization without PHI. Patients expect relevant communication, but HIPAA limits how clinical data can be used in marketing. The right platform supports segmentation based on marketing safe signals, website behavior, declared interests, engagement history, non-PHI CRM fields, etc., so you can still deliver targeted outreach for service lines and community programs without crossing a privacy line. Role-based access and approval workflows. Healthcare marketing isn't run by one person. You've got service line marketers, community outreach teams, location managers, providers, and compliance reviewers all touching campaigns. Permission-based controls and routed approval workflows let you give the right people the right access without losing oversight. Audit-ready tracking and documentation. Compliance reviews, internal audits, and incident response can depend on being able to show what was sent, to whom, and when. Look for clear activity tracking and records to help with audit readiness. Email and SMS for the full patient journey. Healthcare communication spans research, screening, wellness programs, ongoing education, and more. Your platform should handle all of it across email and SMS with automation that scales high-volume programs like screening reminders or class invitations without piling on manual work. Multi-location and service line coordination. Hospitals, clinics, and specialty practices all need different messages, but the system has to feel unified. Centralized templates and brand controls with local flexibility are what keep a 15-clinic network from sending 15 different versions of the same flu shot reminder. Spotlight on the emfluence marketing platform, built for HIPAA-aware healthcare communication. The emfluence marketing platform is specifically built for the realities of regulated healthcare communication. It holds a 89% user satisfaction rating across 171 reviews on SelectHub, and the platform itself emphasizes HIPAA-compliant data practices as a core part of how it's designed, not a feature bolted on after the fact. Here's where emfluence stands out for healthcare marketing teams specifically: compliance infrastructure built in. Emfluence supports HIPAA-aligned data handling through secure, controlled data practices, encrypted data transfer, and protected infrastructure. Role-based access controls limit visibility and editing rights. Approval workflows route messages through required reviews before deployment, and audit-ready tracking maintains the records compliance teams need for internal oversight. For a category where most tools treat HIPAA as a checkbox, this is the foundation. Segmentation that stays marketing safe. Rather than asking healthcare marketers to compromise on personalization or risk PHI exposure, emfluence supports targeting using marketing safe data, declared preferences, engagement behaviors, non-PHI CRM fields, and website activity. The platform also offers an integration with Avid AI that lets healthcare teams activate segments based on patient interests, demographics, satisfaction indicators, or engagement behaviors directly inside emfluence, without additional data wrangling or technical lift. Service line and multi-location campaign automation. Healthcare marketers are able to use emfluence for the workflows that their teams run every day. Examples include targeted service line campaigns for cardiology, orthopedics, oncology, primary care, women's health, and more. more, community health programs for screenings, wellness classes, and preventative care, patient acquisition nurture sequences using non-PHI CRM and website data, multi-location coordination that maintains brand consistency while allowing location-specific messaging where needed, fundraising and donor engagement campaigns for healthcare foundations, including event promotion, recurring giving programs, and donor nurturing using CRM-driven segmentation. Plus, email and SMS work together so high-volume programs like screening reminders or class invitations can scale without manual lift. Internal and provider communication in one. One thing that often gets overlooked is that healthcare marketers aren't just communicating outward. They're also pushing updates, collateral, and announcements to providers and clinical support teams. emfluence supports segmented email and SMS outreach that reaches the right roles internally, which keeps the platform useful beyond patient-facing campaigns. In summary, the emfluence marketing platform is a strong fit if you market for a hospital, health system, clinic network, or provider group, you need HIPAA-aligned data practices and audit-ready documentation, you're coordinating outreach across service lines, locations, or providers, you want to personalize without using PHI and segmentation or sends, you run high-volume programs like screenings, classes, or community events, and you need role-based permissions and approval workflows for internal governance. For hospitals, clinics, specialty practices, and health system marketing teams that need real automation capability without compromising on HIPAA alignment, it's one of the most purpose-built marketing automation platforms for healthcare on the market today. To see how the emfluence marketing platform handles HIPAA-aware healthcare outreach and whether it's the right fit for your organization, schedule a demo through the links in the description. I'm Devin Hennig with SelectHub. Thanks for watching, and we'll see you next time.